Anthony. Thank you for joining us. How are you today?
I'm good.
All
Um,
right, as we get straight into it, let's first address the talk of vaccines globally. What measures are we putting in place for when an actual vaccine is produced?
well, there are two things. Globally, there is a rush to manufacture vaccines. And in fact, there are right now more than 203 different candidate vaccines that are being worked upon globally. They're at different stages of development, so some are in the preclinical trials, some are in phase one, some are in phase two, and there are a number of vaccines that are in the phase three trial, which is the final trial before you actually use it more widespreadly in the general population. So we have um, been working with a number of countries and a number of agencies to see how we can procure vaccines for our population. So we've had initial discussions with the government of India, and through those discussions, we know that India would be working to produce at least 1 billion doses of vaccines um, for sometime early next year. Uh, but once the trial goes through, the phase three trial, once that shows that it's working, then they would produce this 1 billion doses of vaccine. We have also had discussions with the government of Argentina because they also are going to be manufacturing vaccines. And at one of the meetings between His Excellency the President and the President of Argentina, they had these bilateral discussions. And we understand that Argentina is going to be producing 250 million doses of vaccines, and they would make some of that available to countries in South America. So we have since had discussions with them. I had a meeting with the Minister of Health, and then those were follow up with subsequent meetings with the ambassador of Argentina to Guyana. So we'll see how those discussions progress. We have also had discussions with the ambassador here for Russia, and as you know, they have one vaccine that they're right now in clinical trials in Russia. So we'll see what comes out of the clinical trials and whether we can be able to utilize such vaccines here. In addition to all of those, there is a mechanism that was set up by the World Health Organization and CEPI, that's another organization, and Gavi. So they have come together and they realize that many countries around the world might not be able to pay for these vaccines. So they have created a financial mechanism where they will work with researchers who are trying to discover these vaccines, take it through the phase three trial, and then also work with the manufacturers. So that work is ongoing. They have been able to amass the resources, the financial resources, to back these vaccine candidates. Guyana has been working with COVAX to ensure that when a vaccine becomes available through COVAX, that Guyana would be one of the countries to benefit. We have also, because of our relationship with Gavi, we have been assured that whatever the cost of the vaccines through COVAX, that Gavi would cover a substantial portion of those costs for Guyana. There are 10 countries in the region that Gavi is doing that for, and Guyana is one of those countries. Now, even with that COVAX mechanism, COVAX intends to probably give about 20% of the country's population, doses for 20% of the country's population. And the first wave would be about for 3% of the population, followed in a second phase of the remaining 17%. So we overall, through that mechanism, would be able to access vaccines for about 20% of our population, which still leaves other possibilities, and that's why we are working with other partners to see how we can get other sources of vaccines. But while we await for a vaccine, and we have made those arrangements globally, we also have to do internal preparations to roll out this vaccine when it becomes available to us. So we have had internal discussions in the ministry. We have been working with our technical partners like PAHO to start looking at our immunization chain, if you like, the cold chain and all those things that are necessary if we are going to roll out vaccines across this country. We'll have to train personnel to understand the cold chain. We'll have to create storage facilities across the country to make sure that these vaccines are kept at the right temperature and train people to administer these vaccines. Now, the good thing is that Guyana has a very strong immunization program. We have been doing that for our children, and we have had record immunization in Guyana. In most cases, we have achieved close to 95, 98% of these antigens that we distribute to the children. About 98% of them would receive it. So that's a good record. So we know how to give vaccines. Uptake has been really, really good in Guyana. And we hope that when we get the vaccine, that we would be able to, distribute it properly and quickly and effectively to our population. The difference, however, between a vaccine for COVID-19 and the vaccines that we currently handle is that most of the vaccines that we currently have for other diseases, we really give them to children to prevent them from getting sick. With COVID-19, because of the profile of the disease, we are seeing that with COVID-19, older persons are more affected, persons with comorbidities, meaning persons who have diabetes or hypertension or heart disease or kidney problems and so forth, they are more at risk. So we are having an internal discussion within the ministry of how to allocate these vaccines when we get them, because we wouldn't get for every single person in the country, and therefore we'll have to prioritize. Our initial thinking is that we would be looking at our frontline health workers, so everybody in the health system, because they interact with the general public. They are at risk to be able to get infected, and therefore it would be prudent if we give our frontline health workers this vaccine. So that would be one category of people that we want to give the vaccine to. The other groups would be the older persons and, of course, persons with comorbidities, so they can be protected. So as it is right now, these are discussions that we are having to ensure that the people who are more vulnerable would receive the vaccines, and we'll work out a schedule and so forth. So we have a little bit of time, not much, but we have a little bit of time. And over the next few months, as we await vaccine from COVAX, that we will be working to put these mechanisms in place nationally. So, we have to do our work, and I guess, the team here at the ministry and with other governmental agencies would be working to make sure, as soon as we get the vaccine, that it is effectively rolled out to our population.
Right, Minister, if we can briefly address the dashboard from Wednesday. We know that we're about 106 deaths so far, but we have had recoveries. And I guess I just basically want to ask you, how are we faring as a country?
I think when you look at, because the numbers sometimes can look a bit frightening, right? But when they put those numbers, they put the numbers for every person who have had COVID from since it started in Guyana in March up to the present moment. Now, for example, you would see 3,500 or 600 cases of COVID. That doesn't mean that at this present moment we have 3,600 cases of COVID. What that means is from March to now, we have had 3,600 cases, right? Now, most of those persons would have recovered. Uh, Presently, we probably have about 600 or so active cases in all of the regions. So that's very different from when you see this huge number of 3,600 cases. One would think that right now, in this present moment, all these thousands that we are seeing are really infected. That's not the case. So the number that you have to look at is the number of currently active cases, right? And that differs remarkably from the overall number of persons infected. Because of that, you would notice that we have had a remarkable level of recovery. So we have been averaging 79 to 80% of the persons who get infected would recover. And then you have the active cases, those who are currently infected, and they would go through the infection, and most of them again would recover. Unfortunately, we would have had 106 deaths, and the challenge with what we're seeing with the persons who are dying, again, they have underlying conditions such as heart conditions, diabetes. In some cases, we have had persons who had cancer. We had persons whose immune system has been challenged already, so they had HIV. Some other persons had TB and so forth. So, what we are noticing is that persons who have had these other diseases are more vulnerable, and especially if they don't control these conditions. So if somebody is diabetic and for the past 3 or 4 months they have not been using their medication, it means that they don't have any control over their diabetes, their sugar would be spiking, and at the same time, if they get COVID-19, they would have a more difficult time, and most likely they would end up in the hospital and can have a more severe form of COVID. So one of the things that we keep saying to people, if you know that you are vulnerable, if you know that you have been diagnosed with one of these underlying conditions, then you have to take extra precautions. So apart from abiding by using masks and those things, for those persons with underlying conditions, you need to come to the health centers, ensure that you're getting your medication, ensure that you're controlling the other medical condition that you have. So whether it's hypertension or heart disease or diabetes and so forth, you have to make sure that you're getting your medication, you're taking it regularly, you're controlling that underlying condition. And if you do that, then you would help to minimize your risk. So this is very, very important, right? Because from the, the mortality profile that we have seen so far, most of the people who have died had these underlying conditions. Even younger persons that have passed away, they had underlying conditions. So it's something that I think the public need to pay attention to because this is a very important piece of information that they should have and that they should utilize in terms of preventing themselves from getting sick, ending up in the hospital, ending up in the ICU, and they have a high chance if they, have these underlying conditions that they will have a more difficult time in the ICU.
All right. Minister, just for my clarity, how do they go about classifying the COVID-19 deaths?
Well, that's a good question because WHO has put out some guidelines in how you classify COVID-19 deaths. But generally, what we have done, people have been coming to the hospital not suspecting COVID at all, right? So they come maybe because we've had a case where somebody had an accident, for example. They came in because of that accident. When they came to the accident and emergency, one of the things that they will normally do now is to take a swab for COVID-19. And this is done in this particular case to probably know whether or not this person, just as a precautionary measure, just to know whether or not this person is positive, so that the healthcare workers who might be working with this patient can be a little bit extra cautious. They should be generally with every patient that come in. But I think when they know the status of the patient, they're able to be a little bit extra cautious, if you like. And so the general rule now at the hospital, they swab every person who come into the emergency setting, or if a person has been admitted to the hospital, they do the swab on everybody. And by doing that, they're finding a lot of persons who came in for all kinds of other conditions who are also positive for COVID. So their primary reason for visiting the hospital had nothing to do with COVID. But because when they get to the hospital and a swab is taken, you would find that they're actually positive for COVID. And therefore, you have to manage them for both conditions. And we have seen a lot of patients like that. And unfortunately, some of them are coming in with underlying conditions that, are very complicated. And then when you add COVID onto that, it makes it even more difficult to manage that patient. And we have had a number of cases like that. So in a lot of cases, the primary reason for coming to the hospital is not COVID, right? But unfortunately, if these patients passed away, they are recorded as a COVID-19 death, right? Because they also had COVID. So that has been, something that people need to understand. And but we'll continue to work. Our job in the hospitals and so forth is if a patient presents with whatever challenges they have, we have to work with that patient to treat that patient and ensure that they get better so that they can return back to their families. So that's, the mission that we have. And I think so far our healthcare workers have been working really hard to accomplish that mission.
Right. Thank you. We have one last question before we wrap up. How has the education campaign been going? I know it is still on, and how has that been?
Well, we keep working on it, and as you know, we have been distributing flyers across this country. Operation COVID Curb has been really working and reaching out to communities, across the country. The feedback has been tremendous because this is one-on-one engagement. We'll give a flyer, you'll get an opportunity to chat with that person. A lot of times, people are aware of how this disease is transmitted. The challenge has been that they are not complying. Now, I read a study this morning from the state of Arizona in the United States. They didn't have a mass campaign. And what they noticed was they had a lot of new cases. And the state itself implemented a law that people need, or at least in different parts of the states, to use a mask. It was compulsory to use a mask. And after about a week of implementing this new law, in different parts of the state, you know what they noticed? There was a drop by 85% in the amount of transmissions that occur. And they did this study and they measured it and they went through all the rigors of a scientific study and they were able to document that. So a simple thing like wearing a mask makes a big difference. So people might feel that, what am I doing? What can I do? I'm just one person. But if everybody comply by wearing a mask, you can see a drop in the infection rates. And this is a classic case. This study was published a few days ago. And it shows that mask wearing in the public really works, right? And imagine if you add mask wearing and the other measures like social distancing, like the hand sanitization and so forth, then we can even reduce that from the 85% to even higher, right? So because it's a combination of measures. And that's something that we have to keep reminding people that these measures really work. And if we abide by them, we will see a drop in the cases that we are having. Right?
I know another a major part of the campaign also is not only the information, but you've gone at lengths to also share masks.
We have
We have
been doing the leaflets, we've been sharing masks, but we know that a lot of people can make their own masks too, right? So we want to encourage them to do that, to wear it, and we'll stay protected.
All right, Minister, thank you so much for speaking with us.
Thank you.
We've just spoken with the Honorable Minister of Health, Dr. Frank Anthony, who has given us an update on COVID-19 for today. Remember, for this and other information, health-related information, do log on to our website, dpi.gov.gy, and our social media platforms as well, and the Ministry of Health as well, health.gov.gy, and their social media platforms as well. Thank you.